Hi, my name is Peggy Green, and I wanted to come to you and talk to you about diverticulitis disease. I was diagnosed almost 2 years ago. August will be 2 years. And there's just a whole lot of misguided information. And I just want to talk a little bit about what I went through. When I was first diagnosed, um, I became very, very sick. I had abdominal pain in my right abdominal and my left. And at first, I didn't go to the doctor. I didn't think anything of it. I thought it was my age. I was 49. Thought I was going to go through the change. So I really didn't think anything of it. And then I started getting hot flashes. A couple weeks went by and I started getting hot flashes. And again, I thought, okay, it's my age. And then a few more weeks went by, and I ended up vomiting, and I couldn't stop. And so, with that, I ended up having to go to the emergency room, just thinking that I was going to have help getting my vomiting under control. Well, as I was getting registered in, an emergency room doctor overheard me and asked what my symptoms were. And so I said, well, I just have some abdominal pain on my right and left side, and I have some chills. I don't have a fever, but I'm just not feeling well. And he was just said, oh, you have diverticulitis disease. Well, I've never been diagnosed with a disease, and he walked away. And so I'm sitting there thinking, oh my goodness, what does that mean? I no one could give me answers. No one would really say anything. So I got registered in, waited to be called back. They ended up doing a CT scan with contrast, which is dye that they put into your system so they can see things more clearly. Had that done, and they came back with, yes, you do have diverticulitis disease. So I ended up being in the hospital for 4 days. My white blood cell count was really, really high. Um, I wasn't in so much pain that I needed pain medicine, but they did give it to me anyway. And that ended up compounding the whole issues because it made me even more sick. But as time went on, I did get the IV antibiotics. We got the vomiting under control, and then I was able to go home. Well, as they were getting ready to let me out of the hospital, they give me paperwork on diverticulitis, on what to eat and what not to eat. So I get home and I'm reading this paper, and mind you, I'm very, very sick at this point. And I was so confused because the paperwork that said this is what you don't eat totally contradicted the paperwork that said this is what you do eat. They went against each other. And so I didn't know what to do. With this diagnosis came a lot of anxiety. I had very, very, very bad anxiety and heartburn. The heartburn was ridiculous. It hurt so bad. So, with taking the antibiotics that they gave me, I was on after 4 days of IV, I went on another 10 days of antibiotics at home. And they were really hardcore antibiotics. And with that, I did take them the whole time. That the pharmacist said you're going to have a metallic taste in your mouth. You might feel woozy to your stomach. Take these with food. And I'm like, okay, but then you get home and you realize, what can I eat? And there's no information. I go on YouTube, I can't find anything. I tried Googling stuff on diverticulitis, and everything is contradicting of itself. And everyone, it's by trial and error, I was told. And I'm like, great. So with me, along with the anxiety, also came fear. I had this huge amount of fear that came upon me. and I was afraid to eat anything. I didn't want to put anything in my mouth but water. And so about another week went by. So mind you, now I'm almost 2 weeks. I haven't eaten. I'm very weak. The brain fog is ridiculous. Um, so I couldn't think, and it was it was a difficult time. And so after I wasn't able to find any information anywhere, I ended up going through Facebook and finding a group, and found um, this wonderful lady. I guess she saw the desperation in my post of what do I do? What do I eat? And am I going to die? And because I really felt like I was going to. And I have a family, I have kids, I want to live. This is not going to be a death sentence for me. And so I did um, find her, and she literally plucked me out of the group and said, "Message me," and I did. And she literally walked me through this day by day by day by day. And luckily for me, she does everything naturally, and she taught me everything that I needed at that point to know. And so she was just like, start with chicken soup, put the chicken in it, put the carrots in it, put the celery in it, put the spinach in it. And she goes, even if you don't eat it, eat the broth, and at least you're getting some kind of nutrients into your body. And so I started doing that. And I could only eat tiny, tiny portions at a time, very, very small. And so I did that along with I would take a little bit of applesauce and a couple of crackers. And that's about all I could get down. And with the antibiotic, I would do a little bit of applesauce and a little bit of apple juice with that and get that down. Now, mind you, I did get a very bad metallic taste in my mouth, which did make me very nauseous. So I did brush my teeth a lot. I was told chew gum. I'm not a gum chewer, and so that didn't work for me. But I just brushed my teeth a lot, and that did help me. And I also was told to take Jolly Ranchers, the green ones. There's something about the green Jolly Ranchers for nausea, and you suck on that, and it helps with your nausea. And so it was all these little tiny things that I was learning because I had no idea what to do. And as I started eating, I had so much anxiety and fear about putting food in my mouth that I was literally shaking to put the spoon up to my mouth. But I knew that I had to, because it was survival at this time for me. And so I did do that. I did start to get better. Then I started introducing in some supplements. Apparently, a lot of us that have diverticulitis are very low in vitamin D. And so I started taking vitamin D, and that helped tremendously. And so I did get to feeling better each day, a little bit better as the antibiotics went away. It took me about 6 months before the pain in my stomach got better, kind of moved more up towards my belly button area. And I was like, okay, what's going on here? I'm not one to rush to the doctor, and you know, what are they going to do? There's not a lot of information out there. And my doctor was about it's not about food. You can eat what you want. Don't pay attention to any of that. And I didn't say anything. For me, I disagreed. Um, so it's everybody with their own thing. I stay away from popcorn. I stay away from anything that I feel, if a normal stomach can't handle, or can't digest something, because we all know popcorn, corn by itself, uh, we don't digest that. It just goes right through us, and that's on a normal digestive system. And I do not have a normal digestive system by far. So I went ahead and thought, okay, I don't have a normal digestive system. I'm not going to eat popcorn. I'm not going to eat corn. I'm not going to eat red meat. Because the last meal I had before I got really sick was some beef tips, and very hard to digest. Um, I don't eat pork. I cannot digest pork. I can do chicken. I can do fish, shrimp. I do shrimp. I do those two things mostly. Um, but it's a very hard and difficult subject to talk about. I think there's a lot of shame that goes along with it, because nobody wants to come out and say, I'm having problems, going to the bathroom. I'm constipated, or I have diarrhea and I can't leave my house, and it is embarrassing, but it we've got to take that stigma off of it. It's something we all do. We all go to the bathroom, period. And I think we need to talk about it some more. I didn't know that it was not normal to only go to the bathroom and have a bowel movement once a week. And that's what I was doing, and it was a struggle. And so when I learned I was supposed to be going daily, I was like, what? And so these are things I think are important. We need to get out there. We need to talk about it. We need to discuss it. And for my family, I have, especially my 11-year-old, we celebrate when we have a bowel movement, because I think it's important for him to learn at a young age that this is what's normal and this is what's not normal. And we didn't have, all the technology for me growing up. And I don't remember actually having a whole lot of gut issues. At least I don't think I did. And but I'm seeing more and more, even in my own family, my kids having gut issues earlier in their childhood, or as they're getting older, because I have older adult children that are now saying they have IBS, and are very sensitive to certain things like broccoli and kale. I also have IBS to go along, which is irritable bowel syndrome, to go along with the diverticulitis. And so I can't do cauliflower. I can't do Brussels sprouts, which is my absolute favorite vegetable. I can't do kale. I can't do broccoli, because they're very gassy, and they put a lot of gas through my stomach, and they make my intestines very angry. And it does cause a lot of pain. I've tried, it was just a tiny bite of each thing at separate times. By the next day, I was not feeling well. Um, so I'm just coming on. This is my first video. I'm not a doctor. I'm just someone that wants to open this subject up and talk about it. I will talk about anything. You can ask me anything you want. I'm an open book. I've had just the one flare. August will be 2 years that I have was diagnosed and only had the one flare. And so now I'm learning other methods. Now I'm trying to learn more about my digestion, probiotics, good gut health, um, all those kind of things. What probiotics are in certain types of food? How can I make that myself? And so that is what I've been doing probably for about the last 6 months. And I've had tremendous success with it. And another thing I've noticed with this diagnosis is at first I lost 20 pounds. It was like 2 weeks. Just, I lost it. My body went into this crazy mess, and I lost the weight. And then as I started learning about, okay, what do I eat? Because there wasn't a lot out there. You're told, eat white rice. Well, I had stopped eating white rice years ago. I had stopped eating white potatoes because, you're told they turn to sugar, to fat, and then sugar turns to fat. So I had stopped eating all of those things that then I had to reintroduce into my diet. And so I did put on some weight. And so now I'm kind of at that place of I don't want to gain any more, but I need to learn more about this because it's something I'm going to have to deal with for the rest of my life. And I'm really not one to want to rush to a GI doctor. I have talked to one, and nothing against them. But the first thing he wanted to do was a colonoscopy. And it was over the phone. It was during the pandemic. And I was like, I don't even know you. I've never seen you. Like, I need to have some kind of camaraderie with you before I even want to go there. I don't know what his reputation was or anything. So I just told him no, for this time. And, and I've been told by certain, individuals, they didn't have a good experience with the colonoscopy. But then there are others that, if that cancer is run in their family, it's a big, that's something that needs to be checked. And they can check for polyps and see if there's colon cancer, things like that going on. So it can be very helpful. I just kind of, in my own common sense, like, if as long as I don't have a bloody stool, I don't feel like there's anything abnormal. I'm not experiencing any unusual pains. I'm going to try to do this the best way I know how. And so that's kind of where I'm at right now. Is I'm just learning about the probiotics, the type of foods, what I can and can't digest, and what to stay away from. And so if you like my video, give it a like and subscribe to it. And I thank you for watching, and I'll see you later. And if you have any questions, feel free to ask, and I will go through and I will answer them. Thank you very much. Bye-bye.